Sexual health and consent, two topics that should be ignored. Whether you're in a committed relationship or exploring intimacy for the first time, understanding and is essential for protecting yourself and your partner, physically, emotionally, and legally. We often hear these terms thrown around, but what do they really mean? And why are they so crucial for healthy relationships? It's simple. We're talking about respect, safety, and taking responsibility for our own well-being and the well-being of our partners. In today's video, we're breaking down everything you need to know about practicing safe sex and ensuring clear, enthusiastic consent in all intimate situations. Let's get into it. First things first, what exactly is? Safe sex refers to where steps are taken to reduce the risk of sexually transmitted infections, STIs, and unintended pregnancies, while prioritizing mutual safety and comfort. This means open communication with your partner, getting tested regularly for STIs, and using barrier methods like condoms and dental dams during sexual activity. It's about taking control of your sexual health and making responsible choices that protect you and your partner. Now you might be thinking, but Dr. Mike, I'm in a committed relationship. Do we really need to worry about safe sex? The answer is a resounding yes. While being in a committed relationship certainly reduces certain risks, it doesn't eliminate them entirely. STIs can be transmitted even in monogamous relationships, and accidents happen even when it comes to pregnancy prevention. Safe sex is about protecting yourself and your partner, regardless of your relationship status. Remember, knowledge is power. Understanding your own body, your partner's body, and the potential risks associated with sexual activity is crucial for making informed decisions. Safe sex isn't just about preventing negative outcomes, it's also about creating a positive and enjoyable sexual experience for both partners. When you and your partner feel safe and respected, intimacy becomes even more fulfilling. So, whether you're just starting to explore your sexuality or you've been sexually active for years, prioritizing safe sex is an essential aspect of overall well-being. Remember, it's a conversation you need to have with your partner. Open, honest, and judgment-free communication is key to building a foundation of trust and respect in any relationship. Now that we've covered the basics of safe sex, let's move on to another equally important topic: consent. Now let's talk about something as protection: consent. Consent is all about respecting each other's boundaries and ensuring that everyone involved feels safe and comfortable. It's about making sure that every sexual act is a conscious and enthusiastic choice, free from any pressure or coercion. Think of consent as an ongoing conversation, not a one-time question. It's about checking in with your partner throughout the entire experience, not just at the beginning. Consent can be revoked at any time, and it's essential to respect your partner's boundaries if they change their mind, even if things were going a certain way before. Remember, consent is not just about saying yes or no. It's also about feeling empowered to express your needs and desires openly and honestly. It's about creating a space where both partners feel safe to communicate what they're comfortable with and what they're not comfortable with, without fear of judgment or pressure. Consent is the foundation of any healthy relationship, whether it's a romantic relationship, a casual encounter, or even just a friendly interaction. When we prioritize consent, we're not just protecting ourselves from potential harm, we're also fostering a culture of respect, communication, and empathy. So how do we ensure that consent is always present? We talk about it. We make it a normal part of our conversations about intimacy. And remember, consent is sexy. It's about ensuring that everyone involved feels good, safe, and respected. Why are we talking about this? Because ignoring safe sex and consent can lead to serious consequences, physically, emotionally, and legally. Let's start with the physical risks. Unsafe sex can lead to sexually transmitted infections, some of which can have long-term health consequences if left untreated. We're talking about infections like chlamydia, gonorrhea, syphilis, HIV, and herpes, just to name a few. These infections can have a significant impact on your physical health and well-being. Untreated STIs can lead to complications like pelvic inflammatory disease, infertility, and an increased risk of certain cancers. Now let's talk about the emotional and social consequences. Ignoring consent can lead to feelings of guilt, shame, trauma, and broken trust. It can damage relationships, leaving emotional scars that can take time and effort to heal. And finally, there are legal consequences to consider. Sexual activity without consent is illegal and can have serious legal ramifications, including criminal charges. It's essential to understand that consent is not just a moral obligation, it's a legal requirement. By prioritizing safe sex and consent, we're not just protecting ourselves, we're also creating a safer and more respectful society for everyone. Chapter 4. How to talk to your partner about safe sex and consent. Talking about sex can feel awkward, but it's essential. If you're comfortable enough to be intimate with someone, you should be comfortable enough to discuss boundaries, protection, and expectations. Start by choosing the right time and place. Find a private setting where you both feel comfortable and relaxed. It's important to create a safe space for open and honest communication. Be direct and honest. Don't beat around the bush. Let your partner know that you care about their health and well-being, and you want to make sure you're both on the same page when it comes to safe sex. Use I statements to express your own feelings and expectations. For example, instead of saying you should get tested, try saying I feel more comfortable and safe when we both get tested regularly. Listen actively to your partner's perspective. Communication is a two-way street. Pay attention to what they have to say, ask clarifying questions, and make sure you understand their point of view. Don't be afraid to ask questions. If you're unsure about something, don't be afraid to ask. It's better to clarify than to make assumptions. Remember, consent is an ongoing conversation. Check in with your partner throughout any sexual experience to make sure they're still comfortable and enthusiastic. Normalize talking about sex. The more we talk about it openly and honestly, the less awkward and uncomfortable it will become. Remember, talking about safe sex and consent is a sign of respect, maturity, and care in any relationship. Chapter 5. The different methods of protection and their effectiveness. Now let's quickly go over different protection methods and how effective they are at preventing STIs and pregnancy. Condoms are your best bet. They're the only method that protects against both STIs and pregnancy. They come in male and female versions, as well as different materials, sizes, and flavors. Make sure to check the expiration date and store them properly to ensure their effectiveness. Dental dams are thin, square-shaped sheets of latex or polyurethane used during oral sex to prevent the exchange of bodily fluids. They act as a barrier between the mouth and the genitals or anus, reducing the risk of STIs. Birth control methods like the pill, patch, ring, shot, implant, and IUD are highly effective at preventing pregnancy, but they don't protect against STIs. These hormonal methods work by preventing ovulation or thickening cervical mucus, making it difficult for sperm to reach an egg. It's essential to talk to your doctor to determine which birth control method is right for you based on your individual needs and medical history. Emergency contraception, also known as the morning after pill, can be used after unprotected sex to prevent pregnancy. It's important to note that emergency contraception is not a regular form of birth control and should only be used in emergency situations. Remember, using protection consistently and correctly is crucial for maximizing their effectiveness. If you have any questions or concerns about different protection methods, don't hesitate to reach out to your doctor or a trusted healthcare professional. They can provide personalized advice and guidance based on your individual circumstances. Chapter 6. Myth-busting, common myths about safe sex and consent. Let's bust some of the most common myths about sex, safety, and consent. Myth 1. You can't get an STI the first time you have sex. This is absolutely false. Anyone who is sexually active can contract an STI regardless of how many partners they've had. Myth 2. You can tell if someone has an STI just by looking at them. Nope, not true. Many STIs have no visible symptoms, especially in their early stages. The only way to know for sure is to get tested. Myth 3. If you're on birth control, you don't need to use condoms. False. While birth control is highly effective at preventing pregnancy, it doesn't protect against STIs. Condoms are still essential for dual protection. Myth 4. If someone doesn't say no directly, it means they're consenting. Absolutely not. Consent must be clear, enthusiastic, and freely given. Silence or a lack of resistance does not equal consent. Myth 5. You can't change your mind about consent once you've already said yes. This is completely untrue. Consent can be revoked at any time, and it's crucial to respect your partner's boundaries if they change their mind. Myth 6. Talking about safe sex and consent will kill the mood. On the contrary, open communication and mutual respect can actually enhance intimacy and create a more enjoyable experience for both partners. Myth 7. Only women need to worry about safe sex and consent. False. Safe sex and consent are everyone's responsibility, regardless of gender or sexual orientation. Myth 8. It's embarrassing to talk about safe sex and consent. Not at all. It's a sign of maturity, respect, and responsibility. It shows that you care about your health and the well-being of your partner. Remember, knowledge is power. By debunking these myths, we can create a safer and more informed approach to sexual health and relationships. Safe sex and consent aren't just about avoiding risks. They're about creating relationships that are healthy, respectful, and fulfilling. Your takeaways: practice safe sex, use protection, get tested, and communicate openly. Consent is mandatory, ongoing, and enthusiastic. Talking about these topics makes relationships stronger, not weaker. If you found this video helpful, give it a like, subscribe for more content on health and relationships, and share this with someone who needs to hear it.